What about if you've had an operation already and then it hasn't worked adequately, or you're starting to put weight back on? Maybe you've had some children and you found that you've just put on 10 or 15 kilos with your pregnancy, which is actually quite normal. What can you do? Well, there are options for you as well. So depending on the operation you've had previously determines on what's available, and that really needs a careful conversation. If you've had a sleeve, we might be able to tighten it down for you and make it look shiny and new. If you've got reflux, maybe a bypass is a better option. If you've got a lot of weight to lose, maybe the single anastomosis duodenal switch might be the way to go. The SIPS or the SADI procedure, you'll lose a lot of weight with that. That would work really quite well. So there's lots of variables, but there's no doubt that operations second, third time around get harder each time. And also the amount of effectiveness does tend to drop off a little. If you've had a sleeve after having a gastric band, we know the results are not as good as if you had a sleeve the first time around. So very much we like to do a good operation the first time. We don't like to go back and plan to do a second or third operation, but sometimes it does happen. But there's no doubt that when you do it, it's a little bit more complicated, it's a little bit more technically difficult, and the risks are a little bit higher as well. So these things need to be taken really seriously. Have a chat to one of us and we'll tell you what the best options for you are, and then we'll work out what you would like to do. And then we can talk to you about risks and benefit and where this operation might take you.